that from a developmental context, we are the teenager who's got a pretty full-formed personality, pretty strong opinions, a lot of great qualities, but we're also pretty naive and entitled. And we think that we should have all the benefits of being a grown-up without any of the responsibilities. So what are the grown-ups doing? There's been a trend over the last 20 or so years for the American Psychological Association to really look at evidence-based practice. It's a buzzword that's out there a lot, and what does that really mean? I won't go into the details of all the criteria, but it really is a concerted effort to try to highlight the best of the best. What are those interventions, what are those treatments that we feel pretty confident about, that we know work beyond just our experience? And what's interesting, I'll click to the list in a second, the adult list of this has about 80 permutations of interventions and diagnoses. I wanted to focus to balance out, come full circle. We've seen the latency kids, we've seen the young adults. The child and adolescent list is actually pretty small. This is everything that's on the well-established or probably efficacious. There's a couple other categories that APA manages, possibly efficacious and under investigation. But when we look at what has enough of a research base that we feel really confident in saying, yes, they get better, that we're not just saying it from personal experience. This is everything that's on there. A lot of stuff that we see. What's not on here is wilderness therapy. And as a quick side note, there's actually a lot of other things that we do all the time that aren't on this list. There's no DBT on this list yet for children and adolescents. No EMDR. A lot of things that we think are fairly promising, but don't have enough of a research base to fulfill this criteria. In defense of wilderness therapy, my counter argument to us not being on that list, so it's also my philosophy, my belief that wilderness therapy is not a completely new theoretical orientation or intervention all by itself. Often we are a framework, a context in which therapy happens. We are a service delivery vehicle, right? If you peruse up and down that list, there's a lot of stuff there that most of us, when we are providing treatment for our children in the woods, are doing. And so I also believe, and Lauren had some research that she talked about in one of her slides, that there is a restorative component to the wilderness all by itself. There is something healing about just being in the wilderness. We all intuitively believe that, but we also don't believe that it is the only thing that causes our children to improve and get better. We want to do some of this stuff. So we are using approaches and techniques that do have more of a research-based foundation.